Hello, hey, Dr. Fitz here. We did a beautiful video on the Pure Life Medi-Spa Facebook about a week and a half ago, and we wanted to update that information for you. You guys are doing it. You're absolutely doing it. If you recall from the first video, the mortality rate was up to 3.4 to 5 or 6% on the initial data for this virus. Well, it's really important. We wanted to run through a quick update for you that, listen, we've made it through SARS and bird flu and swine flu and MERS and Ebola and Zika and the skeeters. We made it through all of that over all those years. We're going to beat this, and you guys are doing it. The mortality rate initially was 3.6 to 5 or 6%. Now, the mortality rate from the numbers today, directly from the CDC. Next slide there, love. These are from the CDC this morning. The number of deaths was 2,112. You can do this at home. I want to teach everybody so they can do it themselves. The number of deaths since January of 21st, 2,112 divided by the number of positive cases. So next slide, we take that number and the mortality rate. So the mortality rate right now as it stands this morning, on the 30th, it was 6 o'clock this morning, was 1.7%. That means 98% of people survive in the United States as of that date. That information comes directly from the CDC. So 98% of people survive. There's even better news coming. You're doing it. Social distancing, washing your hands, keeping your distance, not being in groups. We got to use our head and stop the spread. This virus appears to be a little more contagious than the others. Next slide, please. So this is really important. So if it's spread more easily, I did tons of research, all that I could find and read on the interweb. I looked and I looked and I looked. So far, this is not spread by talking from everything that I have found or read. It's only spread by contact. Tuberculosis, TB. If you just talk, that one can be spread just by the air. So that's why they were isolated, put in hospitals, and so on. This coronavirus, so far from everything that is available, it is only spread by contact with droplets. You cough in your hand. You then hug somebody, shake their hand, they have a sandwich, or rub their eye. So this one is spread by contact only thus far. The 6-foot distancing is in case someone sneezes or coughs on you. It's to keep that distance. I sneeze pretty hard. It probably will go more than 6 feet. But we're just trying to really prevent that from happening, and it's droplet spread. Next slide, please. This is so important. This is so important. We have done more testing than any country, okay? And there's going to be thousands and hundreds of thousands of people that are going to test positive for the corona. Never treat the test, treat the patient. Never treat the test, treat the patient. What do I mean by that? We do need to stop the spread by using our head. People that are positive just need to isolate at home. And in this circle right here, 80.9% are going to get better. A little Gatorade, Tylenol, they have a runny nose and a cough. So near 81% get better by themselves at home. Them isolating if they're positive stops the spread to the other people. Now, I've got wicked asthma. So does our son Donovan. My beautiful wife takes immunosuppressants for rheumatoid conditions. So listen, we are very respectful and acutely aware of what this respiratory virus can do. This is a respiratory RNA virus. It causes ARDS, matey, ARDS. What's ARDS? Acute respiratory distress, flash pulmonary edema. This is really important because it happens in a hurry when it happens. So what's really important is 80.9% of people that have a positive test, they get better with no problem. The 15% or so, they get really sick really fast. So Skyping a visit is okay, but you can't tell the oxygen level without a pulse ox. This is a respiratory RNA virus. The pulse oximetry, that little thing we put on your finger, if that O2 sat, the O2 saturation is less than 90%, that should generate not only a swab, but a visit to the hospital and possibly even admission to the hospital. So again, So many people are being tested right now. So many people are going to become positive, but there is no fear. Even if you test positive, talk to your healthcare provider, your doctor, somebody you trust, because 80.9% get better on their own. Gatorade, hydration, a little bit of Tylenol, take it easy at home, but don't infect the rest of us, because you're doing it. You've already cut the death rate, mortality rate in less than half. Now the 15%, me and the missus are very respectful. Asthma, rheumatoid, this could be serious really quick. Vital signs are vital. That's why they're called vital signs. So if you're not feeling well, cough, a little short of breath, it's a respiratory virus. Short of breath with a fever, you should check the oxygen level anywhere. A walk-in clinic can do it, the ER can do it. If you're feeling short of breath, wheezy, you need to check that O2 sat. The 15% of people that get ill generates a doctor visit and or hospitalization. Of that 15%, 4.7 or nearly 5% end up on a ventilator for a certain amount of time to assist them to breathe. To review, 100 people test positive. 81% home, isolate, they do fine. 15% sick, coughing up stuff, gotta check the O2 sat. Of that 5% need to be on a ventilator so that they can keep breathing. So if 1 million people get infected at the same time, then that means that 810,000 are going to do okay staying at home. But 4,000 are going to end up on a ventilator out of that million. So now hopefully we just can't have that many people getting sick at the same time. When they say flatten the curve, that means spread out the number of cases by distancing. If you test positive, try not to infect other people. So it's a respiratory virus. 80.9% get better on their own. 15% get sick enough to see me or go to the hospital. Of the 15%, 5% might need a ventilator. But there's good news on that coming. Next slide. Our fancy slides. I'm so sorry about that. So out of France, and you can check this, of course, on the internet. There's been some really, really exciting news out of France where 80 patients were put on that trial of the hydroxychloroquine, Plaquenil, along with azithromycin and zinc. So there is no drug for this bug. This is a virus, not technically a bug. So there's no drug or antiviral to kill this virus. So what are we doing with these three medicines? The hydroxychloroquine is an antimalarial. It's also for lupus. So the ARDS, the respiratory virus, causes flash pulmonary edema, inflammation in the lungs. That hydroxychloroquine can stop that inflammation in the lungs so your immune system can then go kick the virus's butt. The zinc stops the replication of the virus theoretically. It's supposed to really help with stopping the replication. The Z-Pak, azithromycin, if you got a secondary bacteria in your lungs, it takes care of any secondary possible pneumonias that could occur. So again, these drugs are not killing the virus. They're helping your immune system kill the virus. We're stopping that inflammatory response in the lung, the ARDS, the acute respiratory distress. That allows your immune system to then kill the virus, and many, many more people are surviving. In the France study, which you can Google and you can find out for yourself, all of the information that I use is referenceable, okay, CDC and this French study. So 79 out of 80 were cured according to the France study. So you've already cut the mortality rate in half by doing the distancing. You've already cut the mortality rate in half washing your hands and doing that hard work and staying at home and not spreading anything. For the people that have been tested, never treat the test, treat the patient. The vital signs become vital at that point. For a respiratory virus, respiratory RNA virus that attacks the lungs mostly, you want to check the oxygen saturation, and if you test positive, use your head, stop the spread, stay at home and isolate. So do an amazing, amazing job. I know we've got another month to go. Next slide. So now, this is very, very, very exciting. Not only is this cocktail of the hydroxychloroquine, also known as Plaquenil, along with azithromycin and the zinc being utilized in the hospital for incredibly sick patients that are already just really on their deathbed, literally. They've come up with a cocktail that we can use possibly from the office if it gets approved by the FDA and the CDC. So they're making incredible advances even without the medications, because this trial started less than a week ago. You've already cut the mortality rate in half by everybody doing their job. Wash your hands, avoid close contact, social distancing. So even with those simple measures, you've cut the mortality rate in less than half. We are absolutely winning. You're absolutely winning. But with these added therapies, many more lives could be saved. So I can't thank you enough. And all of us that are with Homeland Security said we have to keep our normal hours Monday through Saturday. You just know that we're here. We're here for you. We love everybody. And with a little bit of knowledge, much of the fear could really come down. So again, we love you all and thank you so much for watching.